As at December 2022, 2 years into the COVID-19 scourge, restrictions on religious gatherings, parties, and rallies were lifted in Nigeria. But not before billions of naira had been spent on masks, gloves, and other protective equipment, as well as isolation camps to keep infected people away from the rest of the population. Questions arose about how COVID-19 funds were managed. Connected Development, with support from Oxfam Nigeria, launched a #FollowCovid-19 Money campaign to track and document, as at 2020, how the Nigerian government spent over 187 billion naira COVID donations and interventions from corporate organizations, international agencies, and individuals.
What we did was to aggregate data publicly available, both from government, private institution, and multilateral. But what we also did further was to write a freedom of information letter between Connected Development and SERAP. And the Office of the Accountant General at that time responded to us and said they spent over 30.5 billion. But they also confirmed to us that the Presidential Task Force on COVID-19 spent 22 billion. But they weren't specific around how they utilize this money and what these monies were for.
And currently, the House of Representatives has summoned 83 ministries, departments, and agencies of the federal government as it begins an investigation into the alleged mismanagement of over 447.6 billion naira COVID-19 intervention fund from 2020 to 2022. The Federal Ministry of Health, with Professor Ali Pate now at the helm, outlines plans to improve the health sector.
We produce certain things that we may need in between an outbreak and even when outbreaks occur. We're expanding the Basic Healthcare Provision Fund, which has 1% of consolidated revenue of the Federation in there.
According to the NCDC website, there were over 4,000 active cases as at February 2023. Isolation tents have been pulled down. Canopilas play football on the Sani Abacha pitch, the same space which used to serve as an isolation center. Authorities did not allow Channels TV cameras into the This Day Dome in Abuja. Also in the nation's capital, a 40-bed negative pressure isolation clinic donated by the US government stands empty at the Federal Medical Center. A member of staff says this primary healthcare center in Area 2 is still open to any who want to be vaccinated against COVID-19. But the pace is obviously slower and dedication seems to have waned.
Initiated the Steering Committee for One Health to begin to cooperate in strengthening Nigeria's health security from prevention of the development or the spillovers from animals to human health. 75% of new infectious diseases that are coming into human population are coming from the animal health world.
And to tackle brain drain from the health sector, the ministry plans to train 120,000 existing frontline health workers over the next 4 years and expand health infrastructure and equipment. Mary Alale Yusuf, Channels Television News.